Hi, Dr. Yass here. In this episode, I want to talk about an issue that seems to be relating heavily to the whole COVID issue regarding Twitter and Facebook and all these media areas where they constantly block information from coming out because it's considered misinformation. The whole phrase misinformation has become a huge issue, only seeming to relate to COVID. Well, for 40 years, the medical establishment has been providing misinformation, and nobody's ever talked about it because I don't think anyone even realizes that it's misinformation. So I want to hit home on this point, and I'm going to give you the theoretical, clinical, and scientific evidence, okay? And the misinformation is that osteoarthritis causes pain. I'll say it again. Misinformation. Osteoarthritis causes pain. Osteoarthritis doesn't cause pain. It's not even capable of causing pain. And yet, it's $1 billion industry, easily, multiple billion. Arthritis is huge. It's a mega business. And yet, when looked at from theoretical, clinical, and scientific evidence, it is baseless. Osteoarthritis cannot cause pain. So I'm going to go through these, and I want you to see if you just stay within this video and listen to everything I say, you're going to realize that this is purely nonsensical. So let's start with the most common thought that everybody has. Osteoarthritis relates to inflammation. Let's start with that one. Okay. So most people think that osteoarthritis, they're having arthritis pain, that it's somehow related to inflammation. And if you go to your physician, they're going to give you an anti-inflammatory because you have osteoarthritis pain. So let's go to the idea of what is inflammation. Inflammation is where there's either a mechanical or systemic deficit to a tissue. The body recognizes that. And what it does is it causes a protein to release to a capillary, which causes blood to perfuse to the area to try to heal the tissue. That's called the humoral response. That's how the inflammatory response occurs. So, understanding that, let's say that you had an ankle sprain. What are the 4 symptoms that would acknowledge inflammation has occurred there? Right? You sprained your ankle. You see swelling, heat, redness, and pain. Think about what I just told you. Inflammation is huge amounts of blood perfusing to the area. Blood is warm, blood is swollen, blood would produce redness, and with the huge amount of fluid in an area that it shouldn't be, it's going to create pain, right? So let's go to that idea. We're talking about an ankle sprain. I hit you with a baseball bat, you get a contusion. You had an allergic reaction to a bee sting. You have a pimple. Every one of those things represents inflammation. Inflammation. 4 symptoms: pain, swelling, heat, and redness. Let's go to your arthritic knee joint, your arthritic shoulder, your arthritic hip. Can you point to swelling, heat, and redness where you're having your pain? I would imagine in almost every one of your cases, you're going to tell me no. Now, some people will say, oh, but there's some swelling at the knee where I'm having my pain. Swelling is one of 4 symptoms. You need to have pain, swelling, heat, and redness. There are other reasons other than inflammation to have swelling. Joints have swelling in them, fluid in them, called synovial fluid. Well, if you irritate the joint, it can produce excessive amounts of fluid to try to protect the joint from going through greater range of motion. So you could have fluid, right? You could have swelling, but not be associated with inflammation, the inflammatory response. Okay? So, for almost everybody who's been diagnosed with osteoarthritis as the cause of their pain, they don't have the 4 symptoms indicating an inflammatory response. So, ladies and gentlemen, it is clear and irrefutable based on that understanding that the phrase osteoarthritis is not relating to the inflammatory process. So let's go to what is the theoretical basis of what osteoarthritis is. So we have to look at joints, and a joint is comprised of two joint surfaces approximating one another with a space between them held by either a meniscus or a labrum. That's what makes up a joint. Now, at the end of the joint surfaces, we have bone, but at the end of the joint surfaces is an extremely hard and smooth cartilage called hyaline cartilage. And it is that hyaline cartilage, when the joint is being compressed and you're moving the joint, which is designed to absorb the forces of the weight bearing and function that's occurring running through the joint. So the hyaline cartilage absorbs the forces. Now, when you have your two joint surfaces, they should approximate one another in 100% of the surface area. But due to weakness or imbalance, you might have a misalignment of the joint surface. So in the knee, the femur, the thigh bone, and the lower leg bone, the tibia, might not be aligned perfectly. They might have shifted. So let's say you have 80% of that surface area touching versus 100% of the force running through. 80% wasn't designed to take 100% of force. Therefore, the force is greater than it should be than the surface area was designed to take. So it's going to start wearing down the hyaline cartilage. That white at the ends of that bone is going to start to wear down. Eventually, when it wears down, you have exposed bone. That is the osteoarthritic process. I just defined it. It is not inflammatory. It is a mechanical wearing down of the joint surfaces until the hyaline cartilage is gone, exposing bone. Once bone is exposed, bone will either continue to wear down, or you will have hypertrophic bone growth, excessive bone growth. People like to hear that, oh, in my x-ray, I have bone spurs. Bone spurs are hypertrophic bone growth due to the osteoarthritic process. Bunions are excessive bone growth due to the osteoarthritic process. The wearing down of the surface of the thigh bone in the hip joint is the osteoarthritic process. The osteoarthritic process is a mechanical wearing down of joint surfaces until the hyaline cartilage at the end of the bone surface has been worn away, allowing bone to be exposed. Excessive bone growth or wearing away of bone further deteriorates. That is osteoarthritis. That process is taking decades to develop. Takes so long that it doesn't even elicit pain. I just provided you the theoretical basis as to what osteoarthritis is. Go around, look around. Try to look it up. I can assure you what I just told you is irrefutably what develops osteoarthritis, mechanical wearing down of joint surfaces. It doesn't elicit pain. It doesn't elicit pain. It just doesn't elicit pain. It takes decades to develop. Okay? So that's the theoretical basis. Now let's look at the clinical basis. I love doing this stuff because it's so pure. When gotten the opportunity to understand the information, it's everything you've been told. You've been jerked around by the medical system. You just don't know it. But when you hear this stuff, if you don't see this as the absolute truth, the truth based on natural principles of law, this is how the body works. I don't need a doctor to tell me this. I don't need a pharmaceutical company to tell me. I'm telling you, this is how the body works. So from a clinical perspective, let's talk about where people have pain, right? So let's talk about the shoulder. God, everybody is told they have a bone spur or arthritis like that, right? And yet the person might have pain in the front of their joint when they raise their arm. Well, if I press on the tissue that's creating the pain and they go through the roof, that kind of means that the tissue I'm pressing on is the tissue that's eliciting their pain, right? And that's the bicep tendon. So what's actually happening is you may have some arthritic change in the shoulder joint, but that's not causing your pain. It simply exists. Remember, I told you it takes decades to occur, and it doesn't elicit pain. So it's just an independent variable. It was just identified because you had pain from biceps tendon impingement from strained muscles, and that's what led you to get the X-ray or MRI to identify the arthritic change. Let's look at the hip. Oh, You know, you have arthritis in your hip joint, your pains in your groin. Okay. Well, if it's from the hip, the arthritis, this should be easy. I'm just going to lay you on your side. I'm going to take your hip joint, going to jam the femur into the hip joint. If the arthritis is causing the pain, it should create the groin pain. Do that from here to eternity. You're never going to see it. It's never going to happen. Oh, I'm sorry. So the arthritis isn't creating the pain that I'm experiencing. Right. Because if I press in your groin, I can make you go through the roof, which tells you it's point tender pain. Therefore, it's the tissue in the groin creating the pain, which is the sartorius muscle. The arthritis at the hip, independent variable. You're having pain 3 inches off to the side of your lower back, and you get an x-ray and it says you have bone spurs at your back, your spine. Even if you were psychotic enough to believe that the bone spurs were creating pain, isn't that going to create pain at the spine, at the vertebrae where the bone spur was found? What else would it create? How else could it create anything? And your pain is 2 to 3 inches off to the side. Clearly, the bone spur isn't creating your pain. So, clinically, the average person, when the finding of the arthritic change has been identified, where they're having their pain isn't where it should be. If a bone spur or any of these structural variations, the degeneration in the hip joint is where they're experiencing their pain. The cause is wrong. The arthritic change that was identified couldn't be creating their pain. This is just fact. This is clinical findings. This is the way it works. And if you just looked at yourself, looked at your symptom, you would see that wherever they're telling you the arthritic change is, that couldn't create pain where you're experiencing your pain. So we looked at theoretical, we looked at clinical. Now let's look at scientific. Nobody knows this is true, but studies have shown, okay, first there's the usual type of stuff. As many people without pain have the same arthritic changes as those with pain. So if arthritis causes pain, shouldn't that represent scientifically that all the people who have arthritis have pain and all the people who don't have arthritis don't have pain? God, I would hope everyone would see that as making sense. Oops, that's not what it finds. It actually finds as many people without pain have the same arthritic changes. But here's where it really got wacky. They actually established that there is no correlation between the intensity of the arthritic change and the intensity of pain found. So there are people with massive, massive arthritic changes who have virtually no pain. And then you have people who have the littlest amount of arthritis with the most extreme level of pain. Well, if you went to your doctor, I would assume he's saying, oh my God, you have intense pain because you have all this arthritis, but that's not what you find. I actually treated people. This was so insane, and yet it was allowed to progress. I had people who had pain at the right knee, and they took x-rays of both knees. And the doctor literally said to them, I understand your pain's at your right knee, and I'm a little confused about that because the x-rays show that you have more arthritis at your left knee than your right knee, and you have the pain at the right knee. And yet they're still willing to treat the arthritis. They're saying arthritis causes pain, and yet the knee that doesn't have pain has more arthritic change than the knee that has the pain, and that's okay. I mean, it's just so evident at this point. It's so clear. I just gave you a complete dissertation on osteoarthritis. I told you what causes it. I told you about the symptoms you're having not being where they should be. If the identified arthritis were to cause symptoms, I can tell you, I can give you study after study showing that as many people without pain have the same levels of arthritis as those with pain. And worst of all, the scariest part is that there's no correlation between when arthritis is found and the intensity of pain being experienced at the time. That should scare the crap out of everybody in terms of understanding that there's no way that arthritis is causing the symptom. So you got all your misrepresentations, all the stuff going on with COVID, but the greatest misinformation, and clear in my mind, the greatest misinformation ever produced is that osteoarthritis causes pain. It doesn't. I just proved it to you. Now, if you think that because your doctor told you so, or the pharmaceutical division told you so, therefore it's true. Go for it. Take all the medications, take your cortisone shots, get your surgeries, keep going. But you're gonna probably be finding out all those treatments aren't doing anything to resolve your symptoms. And you're probably gonna find yourself in a shitload of chronic pain, and it's just gonna keep going on. And until you're willing to understand that misinformation has been provided to you, that in fact all that osteoarthritis that was found has nothing to do with your cause of your pain, you're going to be sitting there wondering, how come I'm still in chronic pain? So if this video hits true to you and makes sense to you, now is your time to break away from the system and actually try to go to a method that interprets your presentation of symptoms to let you know what tissue is in distress. That is the Yass method. To get the method, you can contact me by email at drmitch@mitchellyass.com. This will be in the description of the video, or you could go to my website, which is livewithoutpains.com, plural, livewithoutpains.com. And you can make an appointment to get a Yass Method Zoom session. That's the wonderful part of the Yass Method. You can actually get it. You don't have to come to Jacksonville, Florida. You get it by Zoom anywhere in the world. And you go to the website and you can pick the day and time that's most comfortable for you. And we are good to go. So if you like this video, give it a thumbs up. God, I hope you like this video. This one is one of my favorites because the amount of misinformation about osteoarthritis is so, you even still have people talking about their osteoarthritis is genetic based because their mother had it, their father. You have to understand the planet has it. Unless you've been conditioned to understand that you need to have strength and balance to sustain perfect congruency between joint surfaces so they don't rub inappropriately, leading to osteoarthritis, everybody's going to end up having it. So you could say having two eyes is genetic because everybody, my mother and my father had it. Well, it's just the nature of how we are. Having arthritis is just the nature of, if you don't strengthen and sustain balance of muscle, you're probably going to end up with arthritis. So let's end that concept as well. I'll add that in as a bonus to this video. Osteoarthritis is not genetic based. It's not hereditary. So let's add that one in. So if you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional